really appreciate it. I will start by saying that if everybody here joining us on Wise Women Wednesday could do me a huge favor, and can you please go on mute throughout the initial part of the conversation, and please put any questions that you have into the chat. If you have something burning that you want to ask Janet, please do not hesitate to put it into the chat. I will be helping to facilitate answering those questions. And I think that the biggest thing is just like be open, like ask questions that you want to. I would love to start just as we go ahead and dive into Janet. If you have ever engaged in virtual healthcare before, so if you've ever had a virtual visit, or if you have ever met with a nurse practitioner or something over video, I would really love to know. So if you could just put that in the chat and say, I have, or if you have not, go ahead and put, I have not. We're really curious to know throughout COVID how many people have actively engaged. What I would also love to know a little bit more of is if you canceled appointments during COVID and never rescheduled them. And because I think that that's another layer to this that I know I've definitely done that. I'm very behind on my dental visits, which is not something that I love to talk about. I'm very protective over my dental hygiene, but in particular, I would imagine that there's some people that are managing that too. So, okay, well, without further ado, Nurse Janet, thank you so much for joining us today. I really appreciate you taking the time here day post-election. How are you doing?
Doing well, thank you very much, and thanks for having me today, Stevie. I tell Nikki all the time, I love my job, I love what I do. I feel like I'm connecting the dots for people, and it's very rewarding. So
I love that. And you have had such a miraculous career in itself, right? You didn't necessarily start in nursing. This is kind of a second or third act for you, which I think is really a testament to your character of wanting to help people in this way.
Well, I've pretty much always worked in healthcare in my adult life, and early on, worked on the business side of healthcare. But I think because I was involved in so much health education and community interaction and wellness and well-being, that it really spurred my interest and really my passion for helping people be their best self. And so with this most current chapter, I won't say my last chapter, who knows, but with this most current chapter, it's really given me an opportunity with my nursing degree to really pull together my background as well as my passions and what makes me feel purposeful.
I think that's amazing. And we know that so much of healthcare is issues are communication issues. So it's not necessarily delivery of care. It is a lot of times about wading through the mound of information and being able to just simplify and make it less daunting. And I love that. And I know that all of you who are here on this call or going to watch this afterwards will definitely understand why we love Janet so much. I mean, she keeps it real, but is honestly just one of the most incredibly helpful and just inspiring women that you're going to meet. And so we are excited to have this partnership and a resource being able to really help you in this way. So Janet, let's go ahead and dive in, because I would love to get into the meat of the topic today. I think sharing a little bit about what is Easy Care Concierge? And then I think we'll get into a little bit about, so just some tips for people on what they should be looking for in terms of screenings. And then the last portion, we'll get into some dialogue and discussion about how you are engaging with healthcare during this time. And Janet can really help us navigate maybe some questions that you might have in terms of what success looks like.
Perfect. And I'll go ahead and get this open. And I always encourage people to call with questions. And my favorite comment is that, I may not always have the answers, but I can certainly get the answer for you. So everyone see my slides up right now?
Not yet. I think you have to go down and share screen.
Okay, let me try this again. There we go. Let's go back. Okay, let's try it one more time. There we go. All right. There we go.
There we go. I think we're in business.
Awesome. Great. Perfect. So just a little bit about Easy Care. It's free. It's free to anyone. So that's really good to know. I feel like that it's such a great resource, and anyone has access to it. And people often say, well, what does a nurse navigator do? And I'm here to review healthcare questions. I can discuss a symptom or a condition that someone has, and oftentimes they don't know what kind of doctor or specialist they might need. And once we've talked through that, I can help them connect with an appointment. Many people just want a second opinion. And I'll talk a little bit more, or talk more about this later, but we really encourage second opinions. And it's interesting, and I guess I used to be like this, that I didn't want to upset my doctor or make them think I didn't trust them. But it's really a good thing to want a second opinion and go ahead and discuss that with your provider. Because again, the doctors I work with encourage it, and it's a very good thing. Insurance verification. This can be tricky. So it's always good to check that out and to see what parameters you have. And I can always call on my resources to find out if Christ Hospital or our providers are in your network. And we talk about preventative care and screenings, which we will do today a little bit. And then through Easy Care, we also provide community education. We were doing a lot of this prior to COVID. We've pulled back, as you might expect, but we really are looking forward to when we can get back out to our clubs and organizations, businesses, and other employer groups. So how to connect? It's really easy. You can call, email me, or you can even make an appointment with the nurse navigator through the Wise Wellness portal as a member. I'm open to all of those. I get all of those right now. So whatever is easiest for you. And then what happens next? Well, I can arrange a virtual visit or maybe an e-visit. An e-visit's fairly new for us. A lot of the providers are now doing e-visits, and that's simply a text messaging system through your MyChart. And if you need a prescription refilled, or maybe you have a simple UTI, they can discuss that, send you to the lab, or may even order those labs for you through MyChart. I can also help the Prosper members. That's a Prosper level membership through Wise Wellness with getting a virtual visit. And as many of you know, those are complimentary for Prosper members. They get 3 visits complimentary a year. And that conversation might also end up in an in-office visit with a physician, or maybe if it's very urgent, we can get you into urgent care the same day. And Stevie, you alluded to in-office physician visits, and honestly, I'm booking new patient visits, so there's no holds now really on getting in to see a physician, even as a new patient, which is very
wonderful. It's there's nothing worse, Janet, you and I have talked about this, there's nothing worse than trying to establish yourself with the doctor and them saying, oh, well, it's going to be, 2 months. Like, cool, because I'm sick right now. So
right.
It's super great if I could see somebody right now. But yeah.
Yes. And so there are options, even if, we can't find a primary care physician for you to see that day, we can always guide you to urgent care. And because we have urgent care within our system, it's I think, ideal rather than going to a minute clinic down the street, for example.
Yes.
Because all of your medical records are then tied, any labs, anything that's done, if you need to follow up with a specialist or PCP, all of that health information that you've done up to that point is now, is a part of your medical record. So I really encourage people to consider that. And then I can also connect to specialists. As I mentioned earlier, some people don't always know who they need to see in terms of a specialist. And I'll talk a little bit more about that as well. Most often asked questions. Well, Stevie, you talked about people Googling, they phone a friend, they ask their neighbor. And, there's really, in my opinion, they aren't bad approaches. They just don't always get the job done for you. But it really kind of sets the stage for people to say, okay, well, when I do go for this, or I do call Janet, I'll be sure to ask XYZ. So it kind of like primes the pump, if you will, for what conversation you want to have when you do speak to the right person. And people have asked, all kinds of things. As we mentioned, some folks don't even know what kind of a physician they need to see. They may need to see, they think they need to see wound care, but they really need a podiatrist, or vice versa. Or they think they need an orthopedic surgeon when in fact they really don't. They want to avoid surgery. So we have, physical medicine specialist doctors who work with those patients who are in that category as well. And that's not really obvious to most people in the public to know those kinds of things.
Well, and Janet, one thing I wanted to just share with you is, what I've appreciated about Christ is because of the expertise in helping to support women, and knowing that with, women's heart health, or whether it be OBGYN or whatever it is, whenever, if through WISE, one of the most appealing parts is that Janet can help connect you with somebody that specializes in this space too, that we know has a really great track record of supporting women, and a really great track record, not that there's anybody that doesn't in that the Christ Hospital, but they just have more experience in that space. And I think that that's the piece that I really just want to impress is that, Janet has just a lot of really deep knowledge. I get a lot of questions personally through Instagram DMs. I get emails. I get, if I'm out with a friend, they ask me emails, and I'm saying, hey, I'm not the most capable person to answer this. I can tell you who I see or who I know a friend of a friend has seen, but I have a solution for you that can really narrow this down and actually provide a really meaningful direction for you.
Right. And, like I said, I don't always have the answer, but I know who to call. And it's not uncommon that I will, call a physician up or send them a message in our Epic system to say, I've had a patient ask me about such and such. Is this something, would you be a good fit for that condition? And they'll give me a very open and honest answer.
That's great.
So, and we talked about second opinions a little bit. Primary care providers, I just want to say that not everyone is accepting new patients. So rather than, going down through the list and maybe taking your whole afternoon finding the right person in the right location, I can really narrow that down really quickly, and in many cases make the appointment in advance. So, and then just call you up or email you or text you and let you know when that appointment is already scheduled. And we talked about, specific procedures, but people do Google things. And I had a call yesterday, someone wanting to know if we did a particular gynecological surgery. So I stepped right out here in the clinic and asked a few questions and got the answer very quickly. So it's really a good time saver. And Nick, Stevie, you spoke to this, but just as we want to serve the whole woman, I think it really mirrors the WISE wellness philosophy of all the tenets of dimensions of wellness. And so we really consider that it's not just about the traditional things that you think of as women's health, but it's really the whole person and their health. I wanted to talk just a bit about some misconceptions and overlooked facts that I've run into in the time that I've been doing this. It's amazing when I'm out, say, at a community education event, people say, well, I don't really ever get sick and I just don't need a physician. And they use the Minute Clinic for everything. And I have some young people in my life that kind of had that philosophy. And so we've talked about that, but it's not just, those specific, everyone, a lot of people think this. But, I guess I have a personal mission to educate is that, if you don't get sick often, or if you do, the key is that you want to, if you don't get sick often, or you never get sick, in your opinion, you want to see a physician so you can create that baseline of when, what you look like, what your labs are, all of that when you're well. So then if you do have a health incident or something comes up or something maybe changes that you're totally unaware of, that physician or provider can notice that and say, this is not, this is not you normally, or this wasn't how you looked, your labs looked last year.
Can I build on that too? That I think a lot of people, me, use their OBGYN when you go in for your annual as your primary care physician. Because we go in and we ask questions, but the reality of it is they are specialists, right? They are experts in one area, and what you might be missing you might be missing the bigger picture, I guess. So that's something I just, like I said, this is a definite opportunity area for myself, is to get reestablished in this space. COVID kind of screwed that up, but Janet will definitely be helping me reestablish somebody within Christ Hospital.
So you're absolutely right. And, honestly, there's a limited amount of time that, to be fair to the next patient and the next patient and the next patient that's coming through that doctor's office during the day, they have a limited amount of time that they can spend with each patient, just so that they can see all of their patients in a timely manner. So to be fair to you and to be fair to the physician and to the other patients, they can really only cover so much in one visit. So as well as to your point, Stevie, that they are specialists, and while they pride themselves, in considering the whole person's wellness, they really do. They are a specialist. So, and my next point is the importance of family history. I can't stress this enough. And for young folks who really haven't thought much about it, I really try to educate on, and encouraging them to understand their family history and ask questions while there's, they still have family and grandparents around to ask those kinds of questions. Pelvic floor disorders is something else that is really something that's misunderstood. I can't tell you how many ladies will say, well, I'm getting older. It's just, it's like, it's not something you have to live with. Let's get that evaluated. And the other thing is that women are so embarrassed to talk about it. And our urogynecologist really, and the staff pride themselves in making women feel comfortable, from making their appointment to their office visit to follow up. So
and I know Tara is on here too. She knows that my love for leaky ladies, as I used to refer to them back on Always Discreet, 1 in 3 women suffer from adult incontinence, and we're proud to say that we moved the needle from 1 in 9 to 1 in 8 by introducing the brand. there's still a lot of work to happen, but there's just a lot of people that are compensating in ways that you could not imagine. And it's so taboo, but it doesn't need to be. And it doesn't even have to be if you've given birth or if you are getting older. Like, there's so many different things that you can do. And I think that that's the cool part, is that it's not always surgical, right? There's a lot of different options, and just knowing that you don't have to necessarily have that compensating behavior. It really is no different than talking about your period, right? Like, there's so many people that do experience it. But I love the fact that you, as an organization, are really leaning into driving the conversation on this topic.
Right. And you're right. It's not something that just happens to older women. It can happen anytime.
Yep.
And so we
used to talk a lot about athletes. So specifically in the wellness space, people who were highly active, especially a lot of high school athletes that maybe didn't have really excellent guidance and coaching on lifting or on really extending their bodies. That's where we would see a lot of women, in their 20s and 30s kind of living with this and managing it. So.
Right. You're right.
Yeah.
And we've talked about second opinions, but again, I encourage women to say, hey, that's okay. Yes, great idea. And then I also wanted to talk about, how to prepare for your office visit. You want to write your questions down. You want to prioritize your issues. You want to assess, what has changed, and kind of do that before you get to the office. Just kind of go through your mind, well, what has changed? Make notes of that so that you can talk about those changes along with your questions.
I think that's great. And so what I would love to do while Janet's getting into this next phase of preventative health is, I would love to know if there are any kind of misconceptions that you have in terms of or anything that might hold you back from wanting to make an appointment during COVID or not, or what's something that is a barrier for you right now to be able to engage in your healthcare. And you can, if you don't want to share with everyone, you can just share directly with me, or you can hold until the end and come off of mute if you want to talk about it with Janet. But I would just ask you, I just want to understand more of barriers, because what we've learned is that I believe only 80%, I did a poll today, and only 80% of people have never engaged with virtual health visit. And I saw 2 people go in here, but I would love to just learn more about, are there times that you feel like you can't do that? So thank you, Janet.
Sure. Do you want me to move forward, or you want to wait for
That's great. That's perfect. Yeah.
Okay. So I just wanted to spend a couple of minutes talking about what to expect for your preventative care, since I am on my mission to get more women to do this. Well, what is a well woman visit? We've talked about this already, but it's really a clinical encounter that promotes health over the course of a woman's lifetime through preventative care. And that assessment is going to include the things you see here, and should also be discussing, your exercise, your activity level, your mental health issues, your sexual activity, family history, and as we already mentioned, any recent changes. And selecting, let's just pretend for a minute that you don't have a primary care physician or provider, which could include internal medicine, family medicine, or it could be a nurse practitioner. But as I'm helping people, I start to talk about their needs and their preferences. And so I'll ask questions like, do you have a preference for male or female? Do you have a preference for a nurse practitioner versus an MD versus a DO? What part of town do you live? What part of work, where do you work? Do you want something close to home, close to work? And we talk about their insurance. And so it's just talking through all those issues. It really helps to focus and fine tune a good match for them. And then that visit, whether it's your first or maybe that there's, other things that need to be reviewed. Usually for most women, it's done in one visit a year. Some people, if they're on medications, they may need to go back more times than one visit a year. And just a bit about a well visit versus a sick visit, which is, it's pretty obvious, but a well woman visit is over the course of a woman's lifetime. And then, of course, a sick visit is when something comes up and it focuses on a particular diagnosis or treatment of something new that's come up or something already existing. Well, when women visits, you want to have at least one a year, and they should start in adolescence and then continue across your lifespan. So just to review, some of the common things to expect would be, of course, your blood pressure and then your lab work. And then we'll go ahead and talk about some of the preferred numbers that you want. You want your cholesterol total to be less than 200. And I don't know, for those of you who had this done many years ago, that number used to be more. It used to be more like 250, but in recent years, they've lowered that to desired to be less than 200. And your LDL, or your bad, to be less than 100, and HDL, your good, is greater than 40. And of course, your triglycerides less than 150. And then a little bit about diabetes. Some things that are interesting is 1 out of 3 adults in the United States have high blood pressure, and it causes about 410,000 deaths a year or more, and cost about $50 billion a year. So it's a big, beyond just wanting to have a healthy life and a quality of life, it's really an expensive problem for the country. And you want your rough goal to be around 130/80, but you always want to discuss that with your physician, because depending on other things that are going on, that number, you may decide it needs to be higher, or you might live with something, lower, or live with something a little bit higher than that. And just talking about cholesterol a little bit, I thought it was surprising because, that you always hear about high blood pressure being the silent killer. I just came up with this on my own. I think high cholesterol is probably it's high blood pressure's sister, because you don't necessarily ever know you have high cholesterol. And I personally know a very young person who was diagnosed with high cholesterol. They had no idea. Okay. And, early 20s, and had that person not had the right medical care, they could have been well into their 30s or 40s, if that had never been checked. And so much damage would have been done during those years. So it's always good to, even though you feel great, get the numbers checked. Know your numbers, as they say. And then the mammograms and the cervical cancer screening, and then the colorectal screenings. Mammograms are usually once a year, unless there are other conditions that would warrant more frequent. And then also your lung cancer screenings and your bone density screenings. And those usually begin at 50 years of age. And your insurances usually cover those every 2 years. Most insurances will cover those every 2 years. And I also added to my notes some other things that aren't on this list. Eye exams, those are the obvious ones. The skin checks, especially if you have a family history of of skin cancer, or if particularly fair skinned folks sometimes have a higher incident rate. And then your dental exams, and of course the Christ Hospital offers the heart and vascular screenings as well. And wanted to jump back to the mammograms for a minute. We now have a program, a department called Precision Medicine, which is offering genetic counseling and screening for high-risk cancer. It's a high-risk cancer screening clinic. So it's
a little bit more about that, Janet, because I think that some people maybe don't know, like, what does high risk mean?
Well, high risk is you'll go through this questionnaire based every time you are scheduled to have your mammogram and you schedule it. You will get a questionnaire by this lovely bot, if you will, called Gia, and it will come through your MyChart. And I just did it just for fun to see what it was like. And it's very conversational. You'd swear that there was someone on the other side of the screen. And Gia asks you these questions, with family history, your medical history, all sorts of things that would lead into your cancer risks. And based on that evaluation of those answers and responses, may suggest that you need to meet with our genetic counselor.
Okay.
And the genetic counselor is on site here, and that then conversation might lead to more genetic testing.
Great. No, I think that that's important, because a lot of times, if you did not join our breast health and bra styling event, we had an incredible conversation on there's a lot of assumptions and a lot of myths around breast health too, of things that are healthy and things that are not healthy. And so I think it's just really important for you to know that just because you don't test positive for BRCA gene, right, that doesn't mean that you aren't at risk of breast cancer, and that there are a lot of other factors that go into it. So definitely highly encourage that. I want to emphasize that as much as we are talking about a lot of these pieces, the heart health piece is the most important piece of this, in my opinion. And this is somebody who suffered from cervical cancer, right? So the heart health piece on this is the #1 killer of women, period, right? And there's so many things that now are coming into play with mental health and the focus on whole self wellness, that we're unfortunately seeing the awareness of that fact that heart disease is the #1 killer of women. That awareness has gone down significantly. And so I want to make sure that we are, just as an organization and through our partnership with Christ, that is something that we are really looking forward to having more discussions on. In partnership with the American Heart Association, we plan to provide additional training and additional programming around this, because I do think that there's a lot of questions that we won't get into today, but around, it's that weird, like, kind of dark game of like, is it anxiety? Am I having a heart attack? Am I having a stroke? Like, is this just normal? Am I getting old? Like, there's questions like that I think that we just are like, kind of just like, oh, well, I'll just go to bed and see what happens. And like, there's a lot of that conversation happening. I think that it would be just worthwhile for us to dive into, maybe at a different discussion, but also bringing somebody with expertise. So I'll get off my soapbox, but that's just, I think, is an important part of our physical health conversation.
Absolutely. Absolutely. And I will move on to the next piece of information here. I want to go back to lung cancer screening. Those are done usually 55 to 80 years of age. And it's for those who have no signs or symptoms of lung cancer. And it could be that you are a current smoker, or maybe you have quit within the last 15 years, and or you have a long-term smoking history. And I've also added if you've been around a lot of secondhand smoke as well. And I know, there's unfortunate situations where you'll hear children say, well, I never smoked, but both my parents did, and I grew up in the same household. So I would encourage those people to have those screenings as well. And then the bone density, those are done, with the DEXA scan, and people who are at higher risk could be those who've taken steroids, hormonal treatment therapy, or family history, or maybe alcohol abuse, and how to avoid. And Dr. Isley, who's our bone health expert, would say, weight-bearing exercise, calcium supplements, your vitamin D, and avoid smoking and exposure to smoking, and then limit your alcohol. And then a little bit about your immunizations. Just something about the HPV vaccine, in addition to what you see here. This was very encouraging that in teen girls, the incidence of HPV has decreased by 86% since this was introduced in 2006. So I found that very significant and encouraging for females and males to both get that vaccine. So just a bit about preparing for your doctor visit. Make a list of concerns, as we mentioned earlier, and plan to update what your concerns are. Do that assessment before you get to the office and say, okay, what's going to be important to talk about today? Take your information, take your medication list, take your written questions, make sure you can hear and see well. Before I started wearing glasses all the time, I may have my readers, I may not have my readers on me. So be sure to take what you need. And bring a family member or a friend if you think, especially if it's going to be something that's going to be stressful. Sometimes when I'm under stress, I only hear half of what is said, and wish I had heard the whole thing. So don't be embarrassed or ashamed to ask if you can have someone in the office with you. Now again, with COVID, it's always good to ask ahead of time, because they are trying to limit the number of people in the offices, but they'll usually work with you given the circumstance. I said we would talk a little bit more about knowing your family medical history, but especially if there's a history of heart disease, high blood pressure, high cholesterol, diabetes, cancer, particularly breast, colon, or skin cancer, and if there's a history of osteoporosis. Those are all important diagnoses that would be important to mention to your provider. And Stevie, you mentioned mental health. Again, that's another hot button of mine. It's okay to talk about mental health, and very important to talk about mental health. And the providers are prepared to have that conversation with you. So I really encourage people to not be afraid to address it. And even if it's something that needs therapy, medication, whatever, I heard one of our primary care doctors say, it's not necessarily has to be a forever thing. People have things that come up in life that they need help, on a temporary basis. Sometimes there's other things that are lifelong things that need to be addressed, but there are things that just happen on a temporary basis that can be, your quality of life can be improved.
Yes.
And lastly, the supplements, herbs, and home remedies. Oh my, these are not regulated by the FDA, and there's very little research on all of those. There's starting to be more, and some providers will say, hey, the research says that this is okay, and maybe give you a trusted place to order those or to get them through the pharmacy. But you have to be really careful, and that's why it's so important to discuss those with your physician. And the other thing that people don't always understand is those can interact with the other medications you are taking, and they can either make them more, work less, or work in a totally different way than what you want. So again, your doctor needs to know everything that you're taking.
I think that that's really important to just pause on for a second, because I think so much of what people, when I speak to people about different remedies and them not wanting to take, them not wanting to take medication, but them be willing to take vitamins, right? They're willing to do gummy vitamins or vitamin D or something like that. But there's a lot that we're seeing linked to deficiencies that are linked to mental health and also linked to other areas of heart disease if you are over consuming different vitamins that you maybe don't need to. And one thing that Caitlin Bolt-Levitt talked a lot about is things that are not regulated by the FDA are all guesstimations too, right? So it can say like 100% of your daily intake when like it could actually be 300%, and that's completely legal because they have the asterisk on it. And I just want people to understand that like we put a lot of faith and trust in products that that's part of where like your doctor is the expert, and so as you build a relationship with them, I think it's crucial. Jen, I did have a question for you in terms of and maybe you can speak to this or not, or maybe this is for a different topic if it's going to take too long, but I am really interested in integrative medicine and understanding like physicians specifically that might be more interested in those like herbs, supplements, home remedies, things. They might go take down that path, but also incorporate in maybe more like mindfulness or something more holistic versus like prescribing me something right off the bat. Is that something that like if that's something that I call you, I'm like, okay, Janet, I want to get set up with a primary care physician that like takes that into account, and I want a woman. That's something that you can help with, right?
Right.
You
Absolutely.
have this ability and understanding of like, I'm looking for this needle in a haystack. And I think that that's just good to illustrate because I'm not alone in that. We talk about that all the time, that I want a woman and I want somebody that isn't just going to make, farm me pills. So that's great.
Right.
Yep. Awesome.
So just a couple of other things to wrap up. Let's see. So we talked about that, and then plan if you need an interpreter. I don't think the ladies on the call today might, but you might have friends who, if you know that there's going to be a language barrier, encourage them to let their provider know that ahead of time. And the healthcare system doesn't encourage relatives or friends to be the interpreter, but because of HIPAA, regulations. But if the healthcare provider, if the office knows in advance that an interpreter is needed, we can always arrange that, and we have all kinds of resources. Take notes during your visit. Make sure you understand and just let your brain slow down a bit. I mean, even though I work in healthcare, it seems like I come out of the office on that yearly visit, just my head's just spinning because it's like, okay, what did we all talk about? And I have to use this, checklist myself. So it's easy to forget things. Get your any information you need, ask for it either in writing or get it sent to you through my chart. And everyone's busy in an office, but make sure you know who's who in the office and that you know who to call. And if you have questions or follow-up questions, it's always good to feel like you can talk to the other members of the healthcare team in the office or wherever. And of course, make sure that you have your My Chart and that you can you understand how to use it. And the last thing is be honest. And I know this sounds like a no-brainer, but it really is. I tend to want my doctor to think that I am A-okay, and not bring up other little things that they may, might be important for them to know, but I want to think I'm A-okay. So just be honest, prioritize your questions, think about the follow-up questions you might want to ask in advance, and also stick to the point. Share your point of view. It's okay to do this. Say, I don't know, doctor. Are you sure? Or nurse practitioner, or whoever. Just tell me more about that, or I feel this way. And finally, all your questions may not be answered. They may want to refer you on to a specialist. They may need more information, lab work, whatever, tests. So don't be frustrated or disappointed that all your questions aren't answered, but that person should be sort of your gateway to getting those answers.
And I think that that's the layer to this is if you are also you can call Easy Care Concierge for anything, right? It's like if you just any healthcare questions, my recommendation is start with Janet. It's very, very easy and simple. It can be for anybody in your family too. And so this is where Janet may make a referral inside of the Christ Hospital Health Network, or it might be outside of, just depending on what is the right thing for you personally.
Right.
And
Right.
that's just really crucial to understand that, like, she may not, again, like know the exact answer, but she's one step away from knowing the person who does. And so I think that's really, really crucial. That's wonderful, Janet. Well, I really appreciate you taking us through and taking the time. I think that a lot of this is, as we're getting to the end of the calendar year, and as we're finalizing our HSAs, our FSAs, as maybe we've not used up and met our deductibles, this is just such a great time to start to think about making the best use of those. It is, for many of us, a really great benefit that our employers really want to provide to us. And I just want to make sure that if you do have access to health insurance, which hopefully everybody on this call does, that you do use these last couple of months as a reminder to go in and get all of that done and get on the books. And if you haven't had any luck with finding somebody, Janet's your gal. Make sure you refer on anybody who asks me from here forth. I'm committed to sending them to Janet, because, like I said, I'm happy to answer them, but it's just I'm not your expertise. I don't know all the answers. I'll just go to Janet anyways. We had one thing in the chat that I wanted to address, which is really about not feeling fully listened to because you're relatively healthy. And I think that that's the part where, if you can build a really great relationship either with a nurse practitioner or a physician, and really sit down and listen, I would agree with the person that put this in as a private message, that I know that I personally feel more cared for sometimes with a nurse practitioner, and just having a little bit more open and honesty. I also think that part of my expression of that is because they tend to be more like closer to my age and like be a little bit closer to like understanding and going through the things that I'm personally going through. It just happens that way. So I think that might also get back to, maybe it's finding the right person to connect with in that regard and building that trust and relationship, so they might understand a little bit more. Yeah.
It's interesting. I've found that people have there's three buckets, well, probably more than that. They either want a male or a female, but then other people don't really care one way or the other. And then there are folks who could go to an MD, they could go to a nurse practitioner, they don't really care. Mm-hmm. And then there's one that, or DO, or then there's those that want either specifically one or the other. They have a very, and it's, so yeah, that's why I always ask the question.
Yeah. And I think that there's also a piece of this that just letting everybody kind of understand that we know that right now there is there's a lot going on. I think is that the understatement of the year, right? But I think that allowing yourself the self-awareness to know when something doesn't feel normal, or if something hasn't felt normal for a long time, there is no better time now than to go into the next calendar year and having awareness and understanding of what's going on. I think that having the answer, there's so much outside of our control right now, but the one thing you can control is yourself and how you react to it. And that would just be my last call to action, is making 2020 the year that you really do, like, don't be afraid of the results. Like, assume the best possible outcomes. Gosh, wouldn't it at least be great to get a clean bill of health, like, going into the next year, but knowing what you've got to work on. And that, I think that the self-awareness is the most empowering piece. And we here at Wise Wellness Guild are here to support you through a community that is like-minded and wanting you to succeed across all the pillars. And so I see Dania on the call. Dania is one of the owners of and founders of Brilliant Advice, from a financial services and advising lens. And it's just so amazing as we talk about how we invest in ourselves from a financial standpoint, how much that takes to a mental health, and just the awareness and knowing of and having a plan. It's no different with healthcare. It's just all things that as women, we sometimes feel like it's hard, we don't have time to learn it. Well, find yourself a really great partner who you don't need to learn. That's not a skill set you need to learn. You can outsource this a little bit, but you've got to have the accountability to get started. So thank you so much, Janet. I really appreciate today. This is just going to be one of many different discussions that we have with Janet. You will start to see her along many of these Wise Women Wednesday events, where you can ask her questions, pop in, and just serving as actually a friendly reminder that she's here, because I think a lot of times we do forget that we have a healthcare advocate in your corner with Wise Wellness Guild. So Janet, thank you so much. Everyone, have a great rest of your afternoon. If you're here in the Cincinnati area, get outside. It is absolutely gorgeous. Take a deep breath, because it's been a year, and I really encourage you to join us tonight. We have an incredible event planned with Fifth Third Private Bank that we are really excited about, discussing the mass exodus of women in the workforce, and having women who can help us solve and actually identify how we can combat that exodus, and what are some of the financial implications for our economy. So make sure you check us out, wisewellnessguild.com/events to RSVP. It is free. We have almost 300 people registered for the event. So if you can't join us on video, then you can join us on Facebook Live or YouTube. So Zoom is the preferred way to kind of come in, but you can listen to us through your earbuds, 6:30 Eastern time. All right. Thank you, everyone. Have a great rest of your day. Thanks, Janet.
Bye-bye.
Everyone. All right. Bye.